Hello and welcome to Aging Well with Dr. Bob. I'm Dr. Bob Flaherty. I'm a family physician, and today I'll be discussing Decisions at the End of Life, Part 1, Important Documents. Unlike my other presentations, I will not be talking about medicine, physiology, or pharmacology, but I will discuss some other important things. As we near the end of our lives, we face several medical decisions that require the creation of various legal documents, including a healthcare power of attorney, an advance directive or living will, and the portable orders for life-sustaining treatment or POLST. In this presentation, you'll learn more about these decisions and documents, why you need them, how to create them, and how and when to use them. If you already have some of these documents, I think you'll still find this presentation useful. References are given at the bottom of most slides. This presentation is for information only. If you have any questions, be sure to discuss them with your lawyer, doctor, physician assistant, or nurse practitioner. Shakespeare said, "'Tis a vile thing to die, my gracious Lord, when men are unprepared and look not for it." Well, I hope with this presentation, you'll feel more prepared. There are three important legal documents we'll be talking about. The first is the healthcare power of attorney. The second is the Advance Directive, also known as a living will or 5 wishes. And we'll also talk about portable orders for life-sustaining treatment, or POLST. Each of these is important, and each does different things. There are other important legal documents for the end of life, which I will not be considering here, like the non-healthcare or financial power of attorney or wills and trusts. The purpose of these legal documents is to give clear written directions about your wishes. They allow you to specify the kinds of treatments you want or don't want, and they name someone who will make sure your wishes are honored, even if you can't speak for yourself. And equally importantly, they spare your family uncertainty, guilt, and anguish if they have to be involved with decisions at the end of your life. First, let's talk about the healthcare power of attorney. This is a written legal document. You give another person the power to act for you in health and medical matters. This is different from a financial power of attorney that allows someone to deal with your bills, your checkbook, your finances. With the healthcare power of attorney, the person who receives the authority is called the agent or the attorney in fact. You can specify the situations where the healthcare power of attorney would take effect and when the healthcare power of attorney would end. And it's important to realize that the healthcare power of attorney is not only important at the end of life, but can be important if you go into the hospital or have a medical procedure, situations where you might not be able to express your wishes. The healthcare power of attorney can specify what the agent can and can't do. For instance, consent to or refuse any medical treatment, or hire or fire medical personnel, or make decisions about the best medical facilities for you. You can also specify that the agent can visit you in the hospital or other facility even when other visiting is restricted, and that they can gain access to medical records and other personal information. The healthcare power of attorney is a legal document, and it needs to be signed by you and by 2 witnesses. But in states like Montana, you often don't have to have the healthcare power of attorney notarized. A healthcare power of attorney written in one state is usually valid in other states, and the healthcare power of attorney can be revoked by you anytime in writing. The next document is the Advance Directive. That is also a legal document, and it's also known as the living will or the declaration or 5 wishes. In this document, you also name an agent to carry out your wishes if you cannot, and that's usually the same agent as you named in the healthcare power of attorney. This document specifies which life-prolonging treatments you want at the end of life. These treatments can include transfusions of blood and blood products, CPR, cardiopulmonary resuscitation, diagnostic tests, dialysis, administration of drugs like antibiotics, the use of oxygen or a ventilator, or surgery. Advance directives can also address feeding, either oral feeding or tube feedings, fluids, either orally or IV, pain control, other comfort measures, what we call palliative care. It can also address whether you want sedation at the end of life, whether you want an autopsy after you die, and whether you want to donate your organs. The Advance Directive is quite comprehensive. However, you might consider another add-on, an addendum to your Advance Directive called a dementia provision. If you developed advanced dementia, which is defined as unable to communicate your wishes, understand or make decisions, the dementia provision will describe what things you want done and not done, such as comfort care only with pain and symptom relief, feeding by oral or tube, fluids orally or by IV, whether you want medications that would prolong your life, whether you want antibiotics if you should develop a lung infection, kidney infection, or some other infection. Another add-on or addendum to your Advance Directive could be a pacemaker provision. If you have a cardiac pacemaker, then you know that the pacemaker's purpose is to prolong your life and keep your heart beating. The pacemaker provision requests that your pacemaker be turned off in any of the situations described in the Advance Directive, the living will, or in the dementia provision. And be assured that it is ethical and not considered suicide or euthanasia to turn off your pacemaker. It is legal and ethical that patients have the right to end any treatment, including pacemakers. Another add-on would be a narrative. Although this isn't a legal or medical document, it is a document that describes your personal wishes and values and goals, the activities you enjoy and what gives you joy in life, your physical and mental priorities, that is pain relief or mental clarity, emotional comfort, and it describes the biggest fears and concerns you have about the end of your life. This narrative can be very useful because you and your agent can't predict every situation at the end of life, and knowing what's important to you, what it means to be alive, is important information. Choosing an agent can be a little bit tricky. The agent should be 18 years of age or older. They should be comfortable talking with you about your wishes. They should be able to be physically present for you when you need them. You need to trust this person to follow your wishes and do what's best for you and to know your medical situation. And this person mustn't be unafraid to ask doctors questions and speak up about your wishes. Your agent should be somebody that's trustworthy and capable, perhaps your spouse or a close family member, a friend, or even your lawyer. I recommend that you name only one agent. If you name a second agent, then these two agents could disagree, and that could be very confusing at the end of life. However, you might consider naming an alternate agent, that is, someone to act if your primary agent is unavailable. If you're having difficulty determining who you want for an agent, your lawyer can help you choose. Creating healthcare powers of attorney and advance directives is actually pretty straightforward. You can find forms online, in books, or through software. And lawyers can prepare these documents as well. That can be expensive, but it's best to use a lawyer if you have questions about naming an agent or other details. Here's a tip. Use a form or software to create your document, then have it reviewed by a lawyer. This helps you organize your thoughts and may save you some lawyer fees. Many states have state-specific advance directive forms that you can download or order from the state office. This is a typical one from Montana. Other state-specific advance directives are available at caringinfo.org. That is caringinfo.org. These forms are simple, easy, and you do not need a lawyer to prepare these forms. Another good advance directive is the 5 wishes. This is available from fivewishes.org, 5wishes.org. It's also simple, easy, and does not need a lawyer. The third important document is the Portable Orders for Life-Sustaining Treatment, or POLST. It's also called the Physician or Provider Orders for Life-Sustaining Treatment. This document augments, but does not replace the Advance Directive or Living Will, because this POLST is important in a terminal situation and to express if you do not want CPR. They're portable in the sense that these orders will go with you from ambulance to hospital to nursing home. The POLST covers life-prolonging treatments such as hospitalization, CPR, and do not resuscitate or DNR orders, intubation or ventilator, whether you want antibiotics, whether you want feeding or IV fluids in a terminal situation. The POLST and the Advance Directive and Living Will are really different documents. They do different things. For example, the Advance Directive is a legal document, whereas the POLST form is actually a medical order signed by your healthcare provider. All adults should have an Advance Directive, but the POLST form is really for anybody who is seriously ill or frail or in a terminal situation. You need the Advance Directive to tell others who you want to make medical decisions for you and what medical treatments you want or don't want. The POLST form, though, is a medical order that orders providers to give specific treatments during an emergency or terminal situation. You fill out the Advance Directive, but the POLST form is filled out by your health professional, your doctor, your physician assistant, or your nurse practitioner, after they've discussed what you want in your terminal situation. The Advance Directive allows you to appoint an agent or a surrogate. The POLST form does not. It's a medical order. Emergency responders can't use an Advance Directive, but they can use a POLST form because they can follow medical orders. The Advance Directive is often stuck away in a file cabinet or a drawer and not necessarily easy to be found, but you want to be sure to give a copy of your Advance Directive to your healthcare provider and to your agent. POLST form needs to be more available. You should have a copy. Your healthcare provider should have a copy. You can even put these on a state registry online. But the best idea is to attach this to the front of your refrigerator, because first responders, emergency personnel who arrive at your home are trained to look for this on your refrigerator so that they can find the orders that the doctor has given for your care. Creating POLST is pretty straightforward. You can find forms online, or they may be available from your healthcare provider. After you've read through the order, you discuss it with your healthcare provider, and they sign the order. This is a medical order. It's not a legal document, so a lawyer is not necessary for a POLST. I've talked about the three most important documents: the healthcare power of attorney, the Advance Directive or living will, and the POLST. There's a few other documents that might be very helpful for you or your survivors. For instance, a document that describes what you want after your death could be very valuable for your survivors. In fact, a real gift to them. In this document, you describe whether you want burial or cremation or body donation and the disposal location of your remains. You say whether you want a memorial service, where and when, who would preside, who might speak, and even what music you would like. Another final document is your obituary. Now, this is published after you die and announces your passing and shares your funeral arrangements, but it's also a document or an announcement that honors your memory by preserving the most meaningful details of your life story. If you want to get those details right, it's best to write your own obituary before you die. Sounds strange, but it's a valuable thing to do. This is also a real gift to your survivors. Some final considerations. Discuss all these documents with your children. Give copies of these documents to your children. And be sure and review these documents every 1 or 2 years, or if your health changes. Thank you for watching this presentation. I hope you found it informative and helpful. If you did, please click like below and subscribe to keep up to date with new presentations. And check out Decisions at the End of Life Part 2, Palliative Care, Hospice, and Medical Aid in Dying, coming soon on this Aging Well with Dr. Bob YouTube channel. Best wishes and age well.